Good evening, everyone. So nice to see you all again. I am Catalina Grija, functional medicine physician, internal medicine, and certified in nutrigenetics. And my guest today is Dr. Naila Goldenberg. Good evening. Good evening. How are you?
Oh, I'm doing well. I'm from
Great.
Boston and I focus on endocrinology.
Great. So, the best of both worlds here, right?
Yes.
So, we'll be talking today about healthy moms and healthy babies because I think that so many people have problems today with fertility, right? 1 in 5 couples, actually. And after that, a lot of children suffer because of mother's health was not adequate before and during pregnancy, nutrition wise, and root causes of their medical problems were not addressed. And we can try to prevent this. So let's do this. So let's dive into it. Good evening,
Good
Dr.
evening.
Goldenberg. How are you?
Oh, doing well. Thank you.
Great. So, hello everyone. We're here, Dr. Naila Goldenberg and Dr. Catalina Grija. We're both functional medicine physicians. Dr. Goldenberg is is endocrinologist, specialty wise, and I am in general functional medicine with certification in nutrigenetics. And we thought that we would address a very important problem and more common, actually. Um, how are healthy mothers influencing?
And because of that, it's important to um, prepare your body for the pregnancy. And it's not only for women, it's for men too, because they need to have strong sperm to create that strong baby. And for that, we have so many endocrine disruptors that affect male fertility. It's just not funny anymore. And it's you've heard probably about all kind of zebrafish that become turned from female to male or from male to female because of endocrine disruptors that in the water, the pollution affects all of that. And same stuff is occurring to our male population. So be ready or preparing to become a parent. It's not only women's job, it's men's job to have a best possible outcome. And therefore, every party has to eat well and take proper nutrition and supplementation, and maybe have better testing to see if there are any toxicities that possible. Think about family history. Are there any things that you need to check from genetics to be prepared? And there are several laboratories now do offer those genetics. As you mentioned, healthy baby, healthy, or whatever is that panel was.
Yeah, grow baby.
Grow baby. Yeah.
Mm-hmm.
So those are super valuable, I believe, in order to have a good, healthy pregnancy and good outcome from further on.
Right. Absolutely. And a lot of toxins also influence the IQ of the children once they're born. And then a lot of toxins interfere with the development of several issues, like especially neurological problems. And also the children may develop allergies later on in life, like in the first couple of years, like once they reach toddler age, because of what's happening in utero. So definitely so important to make sure that people check for toxic levels of toxins in the blood. Absolutely.
Or urine. And heavy metals, we may not realize, but that we do have exposure to different heavy metals. And we may think, for example, we eat healthy by eating fish, and fish a couple times a week is considered to be a great source of free fatty acid. But unfortunately, many fish, especially deep sea fish, may accumulate mercury and other heavy metals, and that will be passed on. And that's why we know that fish is not advisable, or large fish is not advisable for pregnant women. But guess what? You need to check yourself out before pregnancy if your system is clear from all of those heavy metals too.
Yeah, absolutely. Especially with everybody loving tuna.
Yeah.
Oh no, that's one of the highest levels of mercury fish that all the predators. Yeah, right. It's not a good thing. And about the nutrition, because we see that a lot of the soil is depleted, right? And we don't have enough nutrients in the fruits and vegetables. Even if you choose organic foods, you're not going to get enough nutrients just from eating healthy. Sure,
Yes.
you may avoid some of the toxic components, although any organic field is, has alongside inorganic fields, right? Like not organic fields. So all that you have to take everything again with a grain of salt, because all that water will infiltrate the soil, and the rain, everything comes, and the sprinklers, sprinkle the water with whatever is in the soil, toxins and glyphosate and all the other pesticides, insecticides, and still some of the crop will be contaminated, but of course much less. So anyway, that's the best choice that we have so far, to use organic. But I remember a study that was done in like 2010, where they compared the nutritional value of foods in the 60s compared to 2010. And I remember one of the examples was 1 cup of spinach from the 1960s was equivalent in nutrition to 5 cups of spinach in
Oh my God.
2010.
Yeah.
And we are 14 years later, so you can imagine it cannot be better, it's going to be worse. So
Yes.
it's not possible for us to eat the amount of food that would bring us enough nutrients these days. It's not possible. That's why we need good supplementation.
Yeah.
And absolutely, the health of mom has to be healthy for the child to be healthy. So definitely, mom and dad have to be healthy.
Yes.
It's a two-way street here. Definitely. So the one of the tests that I do, talking about nutrition, I do the micronutrient testing at a cellular level. Spectrocell, right. And I see a lot of people do not have enough different vitamins, different minerals, amino acids, antioxidants, glutathione, CoQ10. So it is so important to check those tests, because the blood levels, the usual blood tests that are done in traditional medicine, in Quest or LabCorp or whatever laboratory, will not tell the whole story, right?
Well, unfortunately, that's true.
Yeah.
We have proper testing to look for what's actually in tissue. And the SpectraCell, I've used that some time ago, and I remember it was intracellular, and that's right. Value. It's actually how much is in tissue, not just how much in the blood, because to have different vitamins and nutrients and minerals inside of tissue, you have to have good channels to transport them from blood into this tissue, into cells. And unfortunately, not everybody has that. So checking it inside is much more valuable than otherwise.
Right. And yeah, I remember I have like recently a patient of mine who had been trying for 5 years to have a child, and she was desperate. Her husband had done the usual testing and everything was fine. And we did this test, and she was deficient in multiple items. Corrected that. In 4 months, she was pregnant.
Wow, that's awesome.
So it's awesome. Sometimes it's more complicated, right? Like I think you said you had a case with toxic substances.
Yeah, I had a case where one of my patients had multiple miscarriages, and she was positive for mycotoxins, which is toxins coming from black mold and other versions of mold. It doesn't have to be a black mold. And that family had to change their housing, they changed their carpet, do the remediation, and it still takes time to improve. And you have to be very diligent at keeping the toxic level down and checking yourself as well, because there is frequently not only mycotoxins, there is allergy, intolerances, sinus infection, and you can harbor your own mycotoxin producing funguses. So aspergillus, certain penicillins, they could live in your sinuses, they could be in your lungs and other parts of your body, and they just happily produce small amount of toxins, but that small amount is enough to affect your immune system, energy level, and ability to get pregnant. So all of that needs to be corrected before you try to get pregnant. And
yeah, absolutely. And I think a lot of people, like I think you mentioned before, that a lot of people don't think that they don't absorb enough. Even if they eat a lot, they don't absorb because their gut is not working properly, right?
Yeah, absolutely. Yeah, and so that's one part of the problem. Other parts would be other root causes. Hormonals, there are multiple cases where I've seen people cannot get pregnant because of thyroid problems and autoimmunity related to that. It's interesting that at a certain point, the normal level for pregnant women for TSH, that's hormone that comes from pituitary and tells your thyroid to work. They've changed that for pregnant because there was a study showing that the best outcomes we can see when TSH is between 1 and 2. And because of that, now we want the pre-pregnancy women to be in that range. So if, for example, you are not eligible for levothyroxine or NP thyroid or whatever other thyroid replacement when your TSH is 5 or TSH is 4, but for pre-pregnancy, you will be started on thyroid replacement in order to bring that TSH down to between 1 and 2 and help you to get optimized and get your body ready for pregnancy. And the baby's getting your thyroid hormone directly, and therefore it's important to have your thyroid levels optimal before you are trying to get pregnant, so your baby will have the best possible IQ too, because low level of thyroid hormones in babies is associated directly with IQ and mental capacity of the fetuses or of children.
Right, right. And I think also, again, looking at all the stressors nowadays, everybody's inflamed, so to speak, because of stress with life, work. They're trying to exercise and they go and exercise for like 2 hours a day, inflaming their bodies even more. They eat all desserts or fast food quickly, let me eat, and they inflame their bodies more. And inflammation will also interfere, right, with the action of any hormone, but especially thyroid hormones, right?
Yes, of course. And high stress will affect your adrenal hormones, and that whole new ball of bark. And of course, you want to deal with stress way before you are trying to get pregnant. And you want to learn how to deal with stress more than even just because stress, everybody's stressed. It's just normal, but how you deal with that, that's a different story. Yeah.
Right. Absolutely. And I think like when you know um exactly what you're dealing with because you had all this in-depth testing. I definitely like the Grow Baby DNA test because it tells you exactly what it, again, genetic
Predisposition.
predispositions you have for preeclampsia, for high blood pressure during pregnancy or seizures, for diabetes during pregnancy, for small baby, large baby, for problems with pregnancy and or delivery, and knowing exactly what lifestyle to adopt, what foods to eat, what to avoid based on this genetic information is paramount. Because I think most things can be prevented if we know what we're up against and take the proper measures.
Yes, correct. And adjust your salt intake, adjust your carb intake or fat intake, and other stuff. And yeah, no, this very, very valuable.
Right. And we were talking before also about MTHFR, right? With so many women have this problem, and then they go into the stores and, or they're prescribed prenatal vitamins. And those prenatal vitamins, most of them do not contain the types of supplements that they need, right? With MTHFR.
Yeah, no methylated version of folate and no methylated version of cobalamin. And as you mentioned, the choline is very good. And yeah.
Yeah, absolutely. So definitely not all vitamins are created equal or have the same benefits. That's for sure not. And then, so I think that before trying in vitro and going through all those terrible treatments and maybe not being successful and then losing hope, I think everyone should really go to the root of the problem with a good functional medicine physician, because that's the specialty that deals with this, and find out again from genetics to micronutrients to hormonal testing, proper hormonal testing, right? Yeah. Dynamic hormonal testing, and good nutritional advice, and then avoiding finding out the evaluation for toxic substances. All this is paramount to achieve to be able to have a baby and to have a healthy baby. Yes, because that's a blessing.
Oh, it is
definitely most important to be healthy, right?
Yeah. It's, as they say that the sick person is thinking only about one thing. It's kind of how to get healthy. Yeah. They don't worry about any more money or whatever. Health is the most important part, and the best gift we can give our children is their health.
Absolutely. Yes, I totally consider us blessed with having healthy children, and my heart goes to people that have children with problems. But even for children with autism, right, there's so many things available now, and again, nutrition, big deal in autism, big deal, huge, right?
Absolutely.
So those children should also have, right, the micronutrient panel done, the genetic testing done, toxic substances levels, and know that there is hope. Everything can improve. We've seen so many cases. So there is always hope if you know what to do and if you're willing to try it.
Correct.
Yeah. Super. So, Dr. Goldenberg, you are in Cincinnati, right?
Yes.
So, your practice is?
Functional endocrinology.
Okay. So, that's where you find Dr. Naila Goldenberg, and I am in Oak Park near Chicago. So, that's where you would find me, Whole Life Wellness. And with that, hope you all got value from this, and we will see you next time. Have a lovely evening, everyone. Bye.
Okay.